I think that all of you know Dr. Mwinzi, same family. I think this is the first family of medicine from Eastern Province. And of course, his other brother was the first African Speaker of the National Assembly. Very distinguished family. We will go on to the next, which is my teacher, Professor Kihumbu Thairu.
Good afternoon, dear colleagues.
Good afternoon.
Like my colleague, Prof Mati, we are honored to be invited to this very important occasion. When people see the medical system today, they forget the battles we had to fight to the background. It started with what was necessary for Africans in African countries. We were young Turks, senior medical students, and some young doctors, when there was only one medical school, Makerere. And we kept on complaining that there's no way we're going to serve our community with just one medical school in Makerere. We should have our own medical schools, not because of political reason, but we need to produce high-level manpower in the right and person power, we should say nowadays, so as to meet the needs of East Africa. Our senior colleagues thought we were peculiar in that we are criticizing the way we worked in those days. Like this poor girl who committed suicide the other day. I didn't know they are still doing that to 6-hour shifts. But that was the order of the day. And you saw over 300 patients per day. At the end of the day, your ears will be sore, the stethoscope. All your fingers have been percussed and they are swollen. And of course, this was no way to practice medicine. When we found that the official system will never listen to this, we remember what Cameron said. We actually were the top performers in society. So we could find our way. So we found our way to President Nyerere in Tanzania, that is Tanzanian colleagues, very young people, and we found our way to Kenyatta. And we got the president's decree that we are going to start training medical students. We're going to open more medical schools. I tried to talk about a medical school in Kenya when I was an intern. I didn't last more than 3 days in Kenyatta. They still owe me 3 days salary. Because our seniors told us we were going to be nothing but general duty medical officers. And in any case, it was a mistake to think of any medical school here because we couldn't afford it, and they had advised the government that we should follow Nyerere's example and produce rural medical aids, in other words, barefoot doctors. When I expressed my disappointment and told my senior, he was a gynecologist, but I disagreed with that, and I wanted to do general medicine and general surgery because I wanted to be a teacher in a medical school. He asked me, which medical school? I said, our own medical school. And so we disagreed, and I resigned and was going to do a job in Shell for a year. and then I was going to say Royal, and then go to a place where I could have a pathway to be a lecturer for a new medical school. Well, anyway, we managed. I went back to Uganda to complete my internship, and then we continued pressing our governments to start our medical school. And you know the work that Joe Mungai had to do. Now, the first year of 67, you remember I taught by vets. So when I came to teach them physiology, they were very comparative. If you asked them about digestion, they'd say, well, in the dog, and in the camel, and also in human, it was a disaster. So to make sure that I didn't see humans, I had to teach day and night, from 7 to 10:30 p.m. at night. Anyway, they managed, Professor Wayler's class. Then, after my PhD, I come to teach physiology. And my professor sits in the classroom at the back. And I was listening to see whether, I suppose, I would make any mistakes. You know, Dr. Rogo, you're right. We are not very unbright, if there's such a word. So, at the end of the lecture, he would tell me, Dr. Thairu, why are you teaching all this? You're over teaching. These people are just going to be general duty medical officers. What is it about this high physiology you're teaching? And I told them, Professor Horobin, I've been teaching your students in London, medical students, dental students. I'm just teaching what I was teaching there. In the end, we disagreed. And I told him, your perception of the future of our country is totally different from mine. These people are going to be scientists, consultants, and they are going to go farther than we have gone. So, leave me alone, because this is my country. After that exchange, Dr. Kekonyo's class remind me, when I tore up all the books they were using, I told that class, these books are not fit for nurses. You are going to be medical doctors of international standards. You are going to be consultants. You are going to be better than us. You're going to be farther than us. Some of you will have your own hospitals. And this kind of nonsense of thinking that in Africa you don't need this kind of thing, we must get rid of. And then as we proceeded, we had the problem of explaining what standards you require in this country. But I had the privilege of, in my final year, doing my surgery in London, and I was surprised in Westminster Medical School, where the last king had his operation. Actually, me and a Tanzanian student who had the scholarship, we were brighter than the students there. I was surprised we could make diagnoses on, I've never seen a white patient, but you could make diagnoses in the ward on white patients we had never seen before, which our fellow students were having difficulty with. We even had problems in theater because Professor Harold Ellis in surgery asked for catgut when he was operating, and then he asked, by the way, why do you call it catgut? And nobody knew. None of his students knew. Then his younger surgeon, who was already a fellow, said, Mr. So-and-so, why do we call it catgut? Couldn't answer. And then said, perhaps our friends from Africa can help. And I told them, catgut is a corruption of KitKat. He said, what? How did you know that? I said, it's a corruption of an old term, kit. And he wanted to know, what's a kit? I said, it's an old form of violin that's not played anymore. So they are wondering what kind of people we were. And so you remember when I became dean, and I started all these very many programs. I wanted to have specialists in every major specialty. And that's why I was in such a hurry to touch psychiatry, diagnosis, radiology, anesthesia. I started finding programs, 13 in all. And in radiology, they said, I had lots of friends in the donor community anyway because of the way you do. If you are good at what you do, you get to know many people. I said, now, why do you mean to train radiologists? And I tried to explain. But I was seeing in your curriculum, you're suggesting that you're going to teach them scanning. You will never afford scans. Your government can't afford scans. The only scans available are in Zimbabwe because they have a large expatriate community. And I told my friends, well, I'm not crazy yet. One day we'll afford scans. Scanning is a political issue if it becomes linked with cost. But I told him I was in Germany last week. I'm a neurophysiologist. I looked at scans of the brain and I could see every part of the brain as though you are operating on it. So that kind of technology should be available to our patients. Don't tell me that only the patients in North of Africa should have access to this accurate means of diagnosis. He said, well, we didn't mean that way, but then you will never afford scans, so what are you going to do? So I said, okay, they will do their 3-year rotation for scanning abroad. The countries who were helping me were Holland, Germany, and England, and we managed. In orthopedics, I was told, you don't need orthopedic surgeons. The main problem of Kenya is contractures from polio. And we have trained clinical officers. They're operating on contractures. So why do you need orthopedic surgeons? So I asked the fellow, if you break a leg, will you call a clinical officer? Or are you going to call Dr. So-and-so, who is an orthopedic surgeon? Of course, I called Dr. So-and-so. I said, I'm trying to make sure every Mwananchi in this country will have access, if not directed through referral, to the same standard of medicine as you have in your country. What annoys me a bit sometimes is 66 when I was a final year medical student. The standard of treatment at Kenyatta National Hospital was exactly the same as the standard of treatment in Western Medical School or Guy's Hospital or St. Thomas's of those days. You could have taken a nurse going for duty, a staff nurse from Kenyatta. The staff nurse could manage a ward in any of the teaching hospitals in England. And it was free. The medical services were free. What happened? And I think we should have a forum in which, having such brains, we are having problems providing health services, and we can't discuss how to get out. How come in 1966 we had these very high standards, and now we can hardly afford to manage vaccines? The first cancer treatment, radiotherapy, was in Kenyatta Hospital. The other hospital, the private hospital, said they couldn't afford it. So we set it up. The first ICU we set up in the Japanese. There were no ICUs in the private hospital because people are not getting that sick. Some of the PhD people can work out why we're getting so sick as we did then. So And it was free. Nowadays, if a patient, anybody goes for ICU treatment for more than 3 months, they have to sell their property to pay. So, while I'm in this company of such brains, I want us to challenge ourselves. Is this the way to go? If the manual laborer cleaning the streets of London got something due to the head injury, he'll be seen in the best hospitals with all sophistication, all the MRIs and scans free. If anybody in Kenya has to be in an ICU for 3 months, you start selling property. The other thing that I tease our people about is, do we really have ICUs? ICUs make people walk around from the marketplace in their boots and walk around patients. We don't acknowledge the drug-resistant bugs you pick in ICU. This just won't do. We have to relook at our profession because we have seen better performance. And we know we are second to none. We are as good as the best. So why can't we have the best system? So thank you very much for inviting us. My wife and I are very grateful. She helped build the library of University of Nairobi for transition from college to university. She was an acquisition librarian. And whenever she saw anything in medicine, she would give it to me. So I would order it, whether it was for ophthalmology or whatever. So it looked as though all these books had gone to physiology. But that's the way we built the library, okay? The other thing I'd like to mention is, all this confusion, Dr. Robi said that most of your teachers, literally all, didn't do private practice. We used to negotiate with the private hospitals. If you want our people to work for you, we have to make proper appointments, part-time consultants, and you give us your requirement and we will decide the hours. Professor Mati, you remember you introduced the idea of geographic practice. That is, practicing private medicine in government hospitals. And Kenyans thought it was a mad idea. But when I was in international health, I was in charge of collaboration in health for the whole 52 member states, about 48 then. I came across a young gynecologist in Zambia who had completely revolutionized medicine in the Central Teaching Hospital, which was taking 55% of the budget before and was really very shoddy and very poor. He introduced your concept, Professor Mati, and Dr. Katema said, from morning to 1, public patients. In the same theater, if you are a surgeon, in the same clinics, you are a physician. From 2 o'clock to whatever you want, private patients in the same hospital. So we know where you are all the time. After all, they are the nationals of your country. Some have money, they want a special treatment in terms of facilities and what you call the hotel-like aspects of a hospital. So it ran like clockwork. I got Professor Masele from Umuhimbili and Professor Meme from Kenyatta and Dr. Kagwa from Bulago. We spent a week studying the system in the University Teaching Hospital. Of course, they learned what they did, especially the idea of Doctor's Plaza. But I'm afraid, and in making oxygen, yes, instead of buying from us, you can make your own oxygen in a container. So we've tried to see what we can do to provide the best service for our people. But instead of doing that, we are surrounded by all kinds of obstacles which I think we can circumvent. So, in closing, I must say, you are very right. African students in medical schools, the pre-selection you go through, so many exams you have to pass before you come into medical school. You are second to none, you are as good as the best, but our health services are not second to none, and they are not as good as the best. So let's not just have this occasion which is so glorious and so wonderful and so enjoyable, but let's also think of posterity. What shall we have, with all our brains, contributed to the betterment of our health system to posterity? One English friend of mine asked me, Kihumbu, you guys are so bright when you are here. When you go back home, what happens? so we have a challenge. And I hope that for the sake of our people and the future, our first-class brains will do something first-class and change the fate of the health system in our country. Last thing I would like to say, I was once in the boardroom of Ministry of Health. We're talking about Millennium Development Goals, and they were going to reduce mortality, malaria mortality by 30%. I was furious. I told them, I know you went to Professor Sack ideas, and I knew Professor Sachs. You should have gone to the Nobel laureate, the Indian Professor Sen, if you wanted advice on a medical service. But to see what I'm talking about, I asked all board members, hands up those of you who had malaria or had malaria in your immediate members of your family. All of us, including me. I had malaria in a hero doing a bit of research. And I said, okay, hands up those of you who have lost a member of their family to malaria. None of us. None of the elite of Kenya had lost anybody. So you're telling me my sister in Homa Bay, if she has 9 children and she loses 3, you say, no, you could have lost all of them, but we have met the Millennium Development Goals. We have reduced mortality to a third. Gentlemen and ladies of the medical profession, our people are waiting for us because not only did we have the privilege of going to a good medical school, we had the privilege of doing well. Let us remember, many people wanted to be doctors, but they couldn't make it because the Almighty did not give them as high IQ. So what did you pay to be bright? What did you pay? Nothing. So let's show those who the Almighty didn't actually give so much mental capacity that we care. Thank you.